Hey guys, how's your neck feeling? Is it stiff? Is it sore? Is it achy? Perhaps it's not stiff, sore, and achy right now, and perhaps it does get that way from time to time. Maybe every now and again you have a big old episode where your neck blows up, it gets stiff and it's sore, and you find yourself limited and a heck of a lot less comfortable and a lot less active than you'd like to be because of it. Well, if that's the case, where you've got neck problems, they either aren't going away or they keep coming on back, this video is for you. I'm going to go through some of the top factors that I find contributing to folks that have chronic or reoccurring neck pain. And when we address these factors and reduce and minimize them, disperse some labor throughout the body, individuals' neck pain tends to drastically reduce, and they're able to live a lot more comfortable and able lives, less run by wondering when is their neck going to blow up or is their neck going to be okay with it. So what are those big factors that tend to contribute to a neck? Well, to understand that, before we list them, you got to understand what the general job of your neck is, and it's really simple. Your neck's job is to hold your head up and allow it to freely look around at the world. It's pretty much it. Now, it's got some stuff below it, and it's got some stuff above it and even within it that may be asking it to do a heck of a lot more than just that. And that's where some neck stiffness, some neck soreness, some neck problems can come about, because the neck may be asked to do far more than it's able to do easily day in, day out. It'll be able to do it, but ask it to do it a lot, and it may not be as free as you'd like it to be. So what's going on below that neck? Well, below it, we've got a rib cage. And in that rib cage, we got a pair of lungs. And those lungs allow us to do one of the most important things that we need to do every moment of every day of our lives, and that's breathe. We need to breathe in order to stay alive. And that rib cage needs to be able to expand in every direction necessary in order to fully get air in and out. Now, when we're just resting and hanging out, we really don't need to take a big breath, but for us to take different shapes and to be able to move our body freely, this rib cage needs to be very mobile underneath your neck, underneath your head. And oftentimes in folks that get chronic neck issues, in fact, folks that get a lot of chronic fill-in-the-blank issues, there is a lack of freedom throughout their rib cage, and it's actually become a cage, not something that has freedom to shift and move around with their limbs below their head, above their legs and feet. So sometimes a visual is a little bit easier than me just shifting around. So here we got a rib cage, and it shouldn't be a terribly stiff thing. When we shift back and forth, this rib cage should be able to shift back and forth. When we lean to the side, we should be able to squish into one side, and we should be able to squish into the other. This requires the other side to expand, and we ideally can do that on your right side as well as your left. And when you take a breath in, ideally we see it expand in every direction, to the back, to the front, not simply one singular direction. And what oftentimes will be going on with folks that have chronic neck issues is they either have a shape to their cage that forces them to be in a chronic position where their neck has to be cranked in order to look forward at the world, and or their cage only expands in certain directions and the neck has got to bear the brunt of it. So what are examples of certain shapes that people will get stuck in for their rib cage? Well, one is a salad bowl. You know, water runs downhill, and some folks will tend to sort of succumb to life, and they kind of collapse in. And it will go inward and inward. The front of their chest will tend to become a bit concave. And if they're female and a bit endowed, it's hard to notice it necessarily, but if they're a slim male, you can see a sunken chest. And when they take a breath in, that sternum doesn't necessarily expand. It may actually go in or not move at all. And instead, they've got to expand in other directions. At times, they overexpand to the back, where it moves that way. Other times they tend to blow up into the neck and the ribs chronically move up. So when a person is stuck in this shape, they may have to really curl forward, the head drifts forward to keep that airway open, and they gotta look forward chronically like this, which is fine, that's just called looking up, but day in, day out, every minute of every hour of every day, it gets a little old. So in those situations, that person is not able to deviate from being hunkered down, looking on up, and they need to get more freedom for the chest to open up in order to allow it to move around more. Other situations are, well, they're not really a salad bowl sunken chest. It's more rigid, and the only place that it's expanding is straight up. And so this is a very tight individual. Nothing is really moving, and the only place where air is going is straight up into their neck. And in that case, these neck muscles, instead of just being available to guide a movement, they act as diaphragms. And the brain, well, it's going to keep you alive. It will exhaust those muscles in order to get air in and out. So in these situations, it's very unique to each individual. They need more freedom for their cage to expand in whatever directions they're not able to load and demand their necks less. So getting it to expand in the other directions, the neck isn't forced into awkward positions, and it's not forced to be the sole mover of that rib cage. There's a big muscle underneath it, not a neck, it's called a diaphragm. And we've got to get them to use that more. So that's stuff below the neck. Above the neck, we got two big contributors, and one is a jaw, and the other are your eyes. With your jaw, that is a floating bone actually within your neck. If we were to remove my jaw, I would have a very funny looking face and neck. Many of the muscles of our neck are woven through our jaw, through this area of our body. So it's very similar to a kneecap being a muscle within your knee. So when we have a tendency to clench or grind, hold tension at our jaw, that is absolutely contributing to someone's neck tightness. They are hand in hand. And so issues that may be contributing to them needing to clench or grind or just simply hold tension at the jaw need to be addressed in order to reduce the overall tension at their neck. Now, up above that jaw, like I mentioned, is a pair of eyes. And folks that tend to have chronic and reoccurring neck issues, well, they either chronically hold their eyes in a particular position. A very common one would be someone that's used to locking their neck and habitually looking up from their skull. So they're always looking up. This individual isn't able to deviate their head while still looking forward. That's how they look and view at the world. They will tend to only look straight forward relative to their head. They don't necessarily move their eyes around. They can also be a little intense sometimes. They go hand in hand. Other folks would tend to chronically look down. That's typically more of that salad bowl chest individual. Either way, we've got to get these individuals to move their gaze more freely from their head, not exclusively in their favorite position that's causing them to lock their neck underneath and around their eyes just to simply see what's going on in the world, where they're going, and what they're trying to do. So all sorts of things can contribute to that. Glasses, contacts, the habits that they have during their day, maybe work demands. Many things can be contributing to all of this. But these are the three big factors: the way that your chest wall is able to expand or not able to expand. It's flexibility. Up above that, you've got a jaw, and if it chronically holds tension, then you're going to have a neck that has a chronic high level of tension. And even further up above that, you've got a pair of eyes. And are they free to look about at the world, or are they only able to look at the world intensely from one angle, and your poor neck has to hold itself that way just so you can get the view that you want? So I hope that's helpful. If any of these factors speak to you, please don't hesitate to reach out to ask if you're interested in any more details. Regardless, I hope you're well, and talk to you soon.